parents can begin getting their children vaccinated next week. So that is our intention.
Thank you very much. Thank you, Chair Murray.
Senator Collins.
Thank you. Dr. Califf, we know that the baby formula crisis was exacerbated by the fact that people weren't working in the mailroom and that inspectors were not working a normal schedule in the baby formula plants. In response to a question from Dr. Cassidy, you referred to a return to work pilot program. How many FDA employees are part of that pilot program as opposed to working full-time right now in the office or in the field?
Well, of course, as you allude to, they're all working full-time. I'll have to get back to you on the exact number, but it's a majority are in the pilot program in one way or another. The goal is to adjust to the maximum productivity and job satisfaction.
But they can't do their work if they're not present.
Well, if it's a job that where they'll do their
cases.
work best if they are present, they are required to be there.
Well, I'd really appreciate getting the data on that.
I look forward to bringing the data to you. I think it's going to be interesting. I'll just say, I was at Google before this. As opposed to Elon Musk, I think Google's doing pretty well with their hybrid program.
Let me switch to another issue. I'm very alarmed by the response that I heard to Senator Sanders' question where he said you should be able to just dial 1-800 to get a prescription, and the administration has pushed very hard on the test and treat program so that you test positive and you get Paxlovid right off. And here's why I'm concerned. The first is that Paxlovid interacts in a negative way with a lot of commonly taken medications, including blood thinners, for example. Second, just on Tuesday, Pfizer announced it was halting enrollment in a trial for Paxlovid in standard risk patients, both vaccinated and unvaccinated, after its study revealed that the treatment was not effective in reducing symptoms in that group. So what we've heard today and what the administration seems to be pushing is this notion that Paxlovid is going to be the answer if you have a positive COVID test. Do you really think calling 1-800 is a good way to handle the prescription of a drug that's been found to not be effective for standard risk patients and has interactions with a lot of medications?
Thank you for asking that question. The place I agree with Senator Sanders is that we have a vastly inequitable distribution of life-saving vaccines and antivirals now, particularly, I know you're from a predominantly rural state, particularly rural people are suffering because they have lower vaccination rates and less access. I don't agree that an individual just calling a 1-800 number with no clinician involved is a good idea. First of all, because the drug's not indicated except in people who are at higher risk. It's not that it's totally ineffective in lower risk. If you look at those data, I'd love to go over those with you later, but it's not worth the prescription in that case. The benefits are minimal. So I think there does need to be an intermediary, either a pharmacist or a physician, who can look at the risks and the drug interactions and make a good judgment. But the concept is right that having to find a physician, get an appointment, can take over 5 days for many Americans. So we have to have a system that deals with that issue.
Dr. Walensky, David Leonhardt recently wrote in the New York Times that while masks can work, the evidence suggests that broad mask mandates have not done much to reduce COVID caseloads over the past 2 years. And in fact, he says that daily average cases per capita during last winter's surge were practically the same in counties and states that had mask mandates and those that did not. And we've seen that Hong Kong, despite almost universal mask wearing, recently endured one of the world's worst COVID outbreaks. There are proven ways to lower hospitalizations and deaths. We know that. Vaccinations, therapeutics. But mask mandates have contributed to a breakdown of trust in public health officials, given the scant evidence that they actually lower caseloads. What specific data has the CDC examined that demonstrate that broad-based mask mandates lead to lower caseloads? Because I can't find any.
Thank you, Senator Collins. I actually believe that that is a piece that's undergone substantial criticism for moving forward. But I will say that there are numerous studies that have demonstrated, and we have to look at this over time because there are secular trends as to when these mask mandates have occurred. There are population aggregate anonymized data that have demonstrated decreased rates of disease when mask mandates have been put in place earlier in the pandemic. And we have to control for all of the things as to what has been opened, what interventions have been available, but there have been other studies for certain to refute those data. Thank you.
Senator Smith?
Thank you very much, Chair.